I have picked Chapter 11 from the Language of Medicine 12th edition, which is the cardiovascular system. Given its importance to life and general health, I find the cardiovascular system to be fascinating. Blood pumping, nutrition, and oxygen delivery, as well as waste product elimination from the body, are all handled by it. As vital components of preserving health, the heart and blood vessels, as well as their functions, are fascinating subjects. Because heart-related illnesses are among the world's top causes of mortality, it is important to understand the cardiovascular system in order to prevent and treat them. The cardiovascular system is organized by the heart, the blood vessels, the circulation, and the blood. The organ in the center that acts as a muscle pump is the heart, which is known as cardio. It consists of 2 atrium and 2 ventricles for a total of 4 chambers. The next part is the blood vessels, which is known as vascular. The arteries transport blood, which are rich in oxygen, from the heart to the rest of the body. The returning deoxygenated blood to the heart are the veins' functions. The capillaries are microscopic blood vessels that join veins and arteries to allow the exchange of nutrients and oxygen with other tissues. Blood travels from the heart to the body's tissues and back again through the systemic circulatory system. Blood flow that provides oxygen to the lungs from the heart is known as the pulmonary circulation. The last part is blood, which is known as hemo. Blood consists of white blood cells, known as leukocytes, for immune defense, and red blood cells for the transportation of oxygen. Plasma is a part of the blood as well, which is a substance that carries waste materials, nutrients, and hormones. By ensuring that blood, oxygen, and nutrients are circulated throughout the body, the cardiovascular system maintains general health. 2 medical conditions about the cardiovascular system that I have chosen are CAD and heart failure. The signs and symptoms of coronary artery disease, known as CAD, are exhaustion, chest discomfort, which is angina, and shortness of breath. Some diagnostic tests that medical professionals will run are an electrocardiogram, which is a test that will record the electrical activity of the heart, a stress test, which is a medical test that will measure how your heart will perform under stress, like exercise, and the coronary angiography, which is a special medical procedure where a dye is injected into your arteries and x-rays are taken to look at your blood vessels. Some treatment options for CAD are angioplasty, which is a procedure that will open up a narrow or blocked blood vessel, a bypass surgery, which is a surgery that will create new pathways for blood to go around blocked or narrowed coronary arteries, and medications, which will help manage and improve your heart and blood vessels. Some signs and symptoms of heart failure are fatigue, swelling, known as edema, coughing, and shortness of breath, known as dyspnea. Some diagnostic tests that medical professionals will run for heart failure are echocardiography, which is a test that will use sound waves to make pictures of your heart, and a blood test for BNP. BNP is a B-type natriuretic peptide, and this test will measure this hormone released by the heart when it's under stress. Some treatment options for heart failure are lifestyle modifications, medications, or in severe cases, a heart transplant. Explaining coronary artery disease to a patient.
You have what we call coronary artery disease. Think of your heart as a pump that sends blood to the rest of your body. It needs its own blood supply to work properly. Coronary artery disease is a condition where these blood vessels that supply blood to your heart become clogged up over time.
Clogged up with what?
They can get clogged with cholesterol and other stuff, which forms something like a traffic jam in the blood vessels, and this makes it harder for the blood to flow through and can lead to problems.
What kind of problems?
When these blood vessels are clogged, your heart may not get enough oxygen or nutrients, and this can cause chest pain or discomfort. And in more severe cases, it can even lead to a heart attack where part of the heart muscle doesn't get enough blood and is damaged.
What can I do to prevent it?
Well, it's essential to maintain a healthy lifestyle, which is like a balanced diet, exercise, not smoking, and maintaining your stress levels. Sometimes, if needed, we might prescribe medications to help lower your cholesterol or control blood pressure. But since you already have it, we can work on a plan together. We can either prescribe you medications or we can perform a coronary angioplasty.
What is that?
It's where we use a small balloon to open up a blocked blood vessel in the heart, and this helps get back blood flow to the heart muscle, which relieves chest pain and reduces the risk of a heart attack. So let's work on a plan together that fits you best, okay?
That sounds great to me.